Uh, Good evening, everyone. Today's lecture is going to be about aortic dissection and aneurysm. So we are going to start with the anatomy of the wall. Just give me a second, please. Just to introduce you to the topic, because when you know the anatomy of the aortic wall, then you're better off to understand the concept and be clear in understanding the disorders. Can I mute everyone? Is there any option?
Yes, click on the participants and mute everyone.
Okay.
Mute all. There is an option by the name mute all.
Okay. The not visible, Nada? I can't see it.
Participant bani click chat.
Oh yeah, I got it. Yeah,
Yes.
sure. Okay. Got it. So everyone is muted now. All right. Okay. So aortic wall, the aortic wall, it consists of three layers: the intima, the media, and the adventitia. And the tunica intima, it consists of a layer of endothelial cells, which are lining the lumen of the vessel, of the aortic vessel, and as well as the subendothelial layer, which is made up of mostly loose connective tissues. And it also consists of tunica media, which is the thickest layer of the arterial wall, and it's composed of elastic fibers, smooth muscle cells, fibroblast, extracellular matrix, and it's this section here, and it's also supplied by the sympathetic division of the autonomic nervous system. And then you have tunica adventitia, or you can also call it the tunica externa. It is the outermost layer of the blood vessel wall, so of the aorta, and it consists of the connective tissues like elastin and collagen, with the vasa vasorum and vasa nervi. And vasa vasorum, these are actually small arteries and veins, the one that are highlighted in red, and these are basically glued in the wall of the large arteries. So they're basically the microvasculature of large vessels, and they supply the cells of the tunica media and tunica intima. So these vasa vasorums, what they do is that they microvasculature of the large arteries, and they supply this section and also this section of the aortic wall. Just a second. Okay, and so aortic wall كده got three layers. Layer tunica intima, that innermost layer da, or bulbaki tunica media, which is the second layer da, or bulbaki tunica externa da. So tunica intima chida that toolna thicker layer da, and double thin layer da, or da asil ke elastic fiber contain ke smooth muscle cells contain ke extracellular matrix like fibroblasts, connective tissues contain ke, and then externa chida da mostly composed of elastin and collagen. And elastin and collagen are important for aortic aneurysm dissections, because they are specifically affected by certain risk factors that affect these components. And that's going to be discussed further. And vasa vasorum chidi agui sakri aga small arteries, the small tiny arteries di delta chiguri aga the aorta passa prudi agui chidi agui tunica media and tunica externa layer the vessel wall supply blood sara, so agui blood daga layers tara say basically. Okay, so this is just a general. So now starting with the aortic dissection. So in aortic dissection, it describes a tear in the intima layer of the aortic wall. So it allows the blood to flow in the intima and media space, and it creates like a false lumen. You can see here. So the most common place for the initial tear to occur is in the ascending aorta, and usually the normal arterial lumen is lined by the intima, and it's called the true lumen. This is the one. The aortic lumen is the true lumen, and then the blood-filled channel in the media, it's termed the false lumen. So when the dissection forms in the space between the intima and media, as the blood fills this area, it creates a false lumen. So the true lumen will often become smaller due to compression by the blood flowing into the false lumen. So usually the aortic dissection معناه كلا دلتا يو دلتا دغا dissection كلا تيري مطلب يو سوري يو چیرې تسوي like یو سوري دلته پیدا شي په انټیمل لیر کې یو سوري پیدا شي نو دغه سوري د وجه نه چې دا بلد د ټرو لومن نه چې دا کنه د ایوتا نه چې د ایوټیک لومن چې ورته هغه نه دلته فلو کوي نو هغه د فلو کوي دلته بلد دلته کلک کیږي او دلته چې دا tunica intima and tunica media په منځ کې کوم سپیس چې دا اغلته بلډ کلکټ کیږي دغلته او دې ته موږ فالس لومن وایو سو کله چې دغلته یو ټیر پیدا شي یو سوري پیدا شي یو اوش کیږي دغه ځای due to like some risk factors due to so that it has its own causes like hypertension and atherosclerosis and many other causes which we're going to discuss and over time څنګه چې کله دا false lumen کله چې the blood accumulates over time هغه دغه true lumen compress kay over time. So, sorry. Yeah. So you can see it here. It's dagalta intima da in dagalta media. The daga menski the blood chida collect kigi through daga sure. And what happens is that in aortic dissection, it can actually propagate longitudinally along the aorta in anterograde form, which means that if it's anterograde, it propagates towards the iliac arteries, and if it's retrograde, it means it can also propagate towards the aortic valve. So when there's a TIA, this means the blood can still flow through the true lumen, or the blood can move in between the intimal layer. And in case, actually three things, in aortic dissection, actually three things can happen. So either the blood will flow in the false lumen, blood will flow from the false lumen back into the into the true lumen and through another flap, or it can rupture, so the vessel wall can rupture, and it can happen due to hematoma expansion in the false lumen and also vessel weakness. And third is that the blood can actually track down through the false lumen and it can start clamping, forming a hematoma, which means like it can form like a pool of blood on the branching vessel, and this can actually results in a narrowing and hence occlusion of the branching blood vessel, and this will result in malperfusion syndrome. So malperfusion is basically one of the main complications. Awaga munga further discuss ko. So usually aortic dissection chida kala chi dissection occurs shi just give me a second please. So kala chi aortic dissection occurs shi no aga dissection chida aga travel longitudinally travel kay ya aga dissection this land is towards the iliac arteries garita z dissection ya dissection ham kideshi che towards the retrograde flow can it back towards the aortic valve talarshi like daga se retrograde matlab towards the aortic valve and anterograde matlab it can continuously dissect and continuously go and flow towards the iliac arteries yani iliac arteries disease munga like extremities disease pesa bu garu tazi and also three shayna mumkin di aortic dissection ki awal chada blood the false lumen kala ch blood pa daga false lumen ki accumulate sho daga false data the dissection area da chada kala blood accumulate sho no da blood ki deshi birta true lumen ta flow ki so daga an example blood false lumen ki accumulate ki in the and then true lumen ta false lumen tarazi and then from false lumen da blood chada birta aorta tarazi and true lumen tarazi alt accumulate kigi. So this is one of the option. Or doim option chada the rupture cause ki dileshi there's also chance of a rupture occurring here, and because the vessel wall is weak so the galta rupture occur ki dileshi. And third is like as a consequence, as a complication, the malperfusion syndrome cause ki. So example, kapadaga area ki zumunga branching arteries kadaga areas ki dagalta ka zumunga renal artery no dagalta dissection kadaga gade ki sashi propagate shi gade ta travel uki no aga dissection chida the zumunga the renal arteries aga compress ki aga occlude ki, and as a result aga agita malperfusion syndrome syndrome بيسكتشي malperfusion syndrome كي blood supply زمون example kidneys تا سكيجي restrict كيجي and compromise كيجي and it causes its own complication. So in terms of classification, so aortic dissection, it may be divided according to Stanford classification into type A, and it can also be called type B. So in type A aortic dissections, this refers to dissections involving the ascending aorta, aortic arch, or both, regardless of the site of origin. And these may extend down into the descending thoracic or thoracoabdominal aorta as well in type A. So Stanford type A is usually very critical because problems with this, if there's problems with this with ascending aorta, it can actually lead to coronary artery problems like ischemia, like infarction, or in other words, you can say that there will be a compromisation of the coronary arteries. So this is why type A is more dangerous, because affect the ascending aorta, which is close to the heart, and to the coronary arteries, I mean. Also, management differs from type B. So the management in terms of treatment, type A has a different treatment compared to type B. And as you can see, this is so basically there's two classifications. One is Stanford classification, and then there's also DeBakey classification. So the focus is now just on the Stanford classification. DeBakey we're going to come to. And so this is type B Stanford classification, this one. And in type B means that aortic dissection, it usually occurs distal to the left subclavian, and it usually involves the descending thoracic and thoracoabdominal aorta. So what happens basically per Stanford classification, so dua raqam classification the aortic dissection, you're the Stanford classification, you're the DeBakey classification. So per Stanford classification kimunga type A laru or per type B ham laru, or type A chida aga ascending aorta daga ascending aorta affect kay, or aortic arch ham affect kay, or dua together affect kay, and sometimes it can also involve yani daga descending aorta ham involve ki warsara sometimes. Or that type A chida like dangerous da more critical the zakachi delta ascending aorta affect ki or kalachi ascending aorta affect chi matlab da zamon coronary it increases the coronary artery risk of occlusion increase kai, or the dear prone kai sishi so ischemia cause kia over time myocardial infarction cause ki sudaga coronary arteries compromise ki zakachi ascending aorta coronary arteries dear nish deda bal per type B كده إنه داخلي area affect داخلي descending aorta affect descending aorta the subclavian artery na land the comportion كده دغه push like subclavian artery na land the aorta descend ki arena like start ki the dissection the arena start ki, and type B is not that it's also serious. I mean, all the dissections are serious, but type A is more serious type. And also in terms of treatment, the dwara different, the treatment different. So type A is more surgical treatment compared to type B because it's more serious. And the DeBakey classification, this is basically it's also commonly used classification. And DeBakey we have this is DeBakey type 1, and this is DeBakey type 2, type 3, and type 3 is further divided into 3A, or you can say 3B. So with DeBakey, so basically in that dwara DeBakey type 1 and type 2 it comes under the same as Stanford type A classification. But in DeBakey dissection type 1 dissection, it involves again the ascending aorta, same as Stanford type A. Will involve the arch, the descending aorta involve and abdominal aorta hump.
Dr. Farha?
Yeah.
Sorry for interruption. Just please, can you highlight the points on the diagram with a cursor or anything highlight?
Oh yeah, sure. Okay, I was just pointing with this. I thought it will be highlighted. Okay, that's fine.
It's not visible properly. You can just mark with a highlighter.
Yeah. If I'm speaking too fast, just let me know so I can slow down.
Yeah, a little bit slowing will be.
I'm sorry. I'm sorry. Okay, I will slow down. Okay. So the Baki classification to the aga ascending aorta involved case to the point ascending aorta da be daga area to the aortic arch da and daga area to the data munga descending aorta wayu ya warta abdominal aorta area warta wayu op the Baki type A to the yani daga 3 areas involved the and as I said it can extend to the abdominal aorta as well. Upper Dibaki type 2 kichida, daga khali ascending aorta involved so daga area basically ascending aorta, like ascending aorta. So daga area khali da involved Oh, Dibaki type 3 chida, aga khali sa involved like descending aorta khali involved so this area daga sur from here to here. Awaga actually start kigi the subclavian descending aorta matlab start kigi the subclavian artery na baat che our region razi agizina saki start kigi so it arises distal to the left subclavian artery and type 3 Debaki, it's basically further classified into type 3A and also further classified into type 3B. And in type 3A, this affects the region above the diaphragm. So this area, this is the diaphragm region, and this is the descending aorta. This is above the diaphragm that's being affected. And in type 3B, what happens is that here the affected region extends below the level of diaphragm as well. So in type 3B, it also affects the region below the diaphragm. So this is the diaphragm. This area is also affected. So Debaki classification that type 3 that further divide kigi into type 3A and type 3B or type 3A chida aga khali descending aorta tar diaphragm puri affect ki or type 3B chida aga descending aorta the diaphragm na land the ham affect ki so daga whole region lekin padaga ki khali the diaphragm na pass chikam descending like aorta da aga region khali affect ki. So I hope everyone understood this section. Is any okay? Okay, so in terms of causes, or you can say risk factors. So one of the main risk factors is hypertension. It exerts shear force, which is enough to tear the wall, or you can say it increases the wall pressure on the aortic intimal layer and predisposing it to tear. So you have got like vasa vasorum, which are the tiny blood vessels that we talked about earlier that exists on the aorta that supplies the tunica externa and tunica media. So due to hypertension, what they do is that they will undergo arteriosclerosis, meaning the blood in them is not flowing well through them, and as a result, it will lead to decrease in blood flow to the tunica media. And if there's a lack of blood to these layers, like if there's a lack of blood to tunica media and tunica externa, they will undergo necrotic processes and will no longer be able to attain the strength. So the vessel wall becomes weak and they become very susceptible to having a tear. So for hypertension, the main cause that is the aortic dissection or the main cause zaka chekala hypertension shino pa blood pressure the pressure the aortic wall ki pressure ziyati or chekala pressure on the aortic wall ziyachino aga tear yani sata aga sureta did aga predispose ki when there's zaka pressure pa aortic wall ki pressure diri no aga सके susceptible कि आगा दिर पासाने बांधे अल्तबे सूर्य पैदा की दलेशी पर intimal layer की due to increased pressure और the increased pressure चदा aga vasa vasorum che mungu wela tiny blood vessels the aorta le pasa che externa and media blood supply ki chikala increase pressure ushi no the increased pressure the vagina the vasovasorum chi agui the atherosclerosis undergo kai matlab agi or the as a result of atherosclerosis blood chi da kana pa vasovasorum ki say nizi no zaka ka blood supply pa vasovasorum ki say ni there's a lack of blood no the vagina chi da blood supply tunica media ta or tunica externa ta ham compromise kigi or as a result tunica media and tunica media agui do necrotic processes undergo kai yani agui د خپل strength د لاسه ورکي څنګه چې موږ tunica media هغه smooth muscles لري او دواره layers چې دي tunica media and externa چې دي هغوی smooth muscles لري collagen لري elastin لري so connective tissue چې زمونږ د aortic wall ته ډیر strength ورکي او کله چې هغه ته blood supply کم شي oxygen ورته کم ورسیږي نو هغوی د necrotic processes undergo کوي مطلب هغوی د ډیر weak کیږي they die out kind of and هغوی د strength چې د هغه lose کوي په حساب ویکټ شوی یا یعنی هغوی ډیر ضعیف کیږي او خپل strength lose کوي and therefore الته tear چې د هغه ډیر prone کیږي چې they become more prone to having a tear نو الته دا سورې پیدا کېدل dissection پیدا کېدل ډیر صحیح به ډیر په اسانه باندې dissection دغه سورې پیدا کېدل شي in case of hypertension او بل cause the aortic dissection چې دا هغه aortic aneurysm دا so increase aortic so basically in aortic aneurysm دا خپل یو غټ topic د چې موږ explain کوو وروسته so په دې کې there's an increased aortic diameter which is associated with elevated wall stress on the aortic intimal layer and this again predisposes it مطلب دا ډیر اساس کوي ست سورې جوړول ته dissection جوړول ته دا ډیر اساس کوي aortic aneurysm and another is like trauma college example surgical procedure undergo like cardiovascular surgery ya come car accident to she are doing a valve repair during the surgeries per surgery ki as a trauma ham dissection accident cause ki daleshi and another important cause is actually vasculitis and in vasculitis, this basically it causes inflammation again of the vasa vasorum that will alter the blood supply to the tunica media. So it will lead to again cystic tunica media degeneration, which is again necrotic processes. So example vasculitis could include tertiary syphilis. It could example include tracheostomy arthritis. I'm sure you guys have already read about vasculitis. It's also a risk factor in aortic dissection. So people with vasculitis, what happens is that these patients, they develop, so example in tracheostomy arthritis, these patients, they develop inflammatory granulomas that gets deposited within the vessel wall and they cause inflammation. So over time, it leads to degeneration of the media, tunica media, and it predisposes for easy tear in case of an acute rise in blood pressure. So vasculitis jihada aga ham your risk factor the cause the aortic dissection. For vasculitis ke aga usually example tertiary syphilis show tracheostomy arthritis should I say which the the vasa vasorum التهاب cause كاين vasa vasorum چې دا کنه هغه prone کی چې هغه سش inflammation یعنی پکې التهاب پیدا کوي دغه vasculitis او چې کله په دې کې التهاب پیدا شي نو دا blood supply again چې موږ ویل کله چې blood vasa vasorum affect شي blood supply په vasa vasorum کې like compromise شي نو هغه نشي کولای چې tunica media ته یا externa ته صحیح سکی oxygen سکی blood water supply ki so as a result the layers the aorta چې دي هغوی affect کیږي again necrotic process undergo کوي and هغوی چې کله دغه layers affect شي چې ویل like tunica media tunica externa چې affect شي the aortic wall د weak شي د خپل strength lose کوي نو د دې د وجنه الته یو سورې پیدا کوي نو دا ډېر like سورې ته predispose کوي so the whole thing is about mainly well, if there's a weakness in the vessel wall, if there's a weakness in if the tunica media region or the adventitia region has been affected, so it's all related to the weakness that leads to dissection. And another reason is also bicuspid aortic valve. And here there's like two, so this is usually some people are just born with bicuspid aortic valves. And this is where two valve cusps, so these two valve cusps, example, they fuse together and they create the bicuspid valve, and this increases the risk So this is the bicuspid valve that you get, and this increases the risk of formation of the aortic stenosis, which in turn increases the risk of hypertension, which is again the main cause of aortic dissection. So bicuspid aortic valve da diogen da ham genetic da bazi insanan di bazi individuals dido genetically da bicuspid valve instead of tricuspid ones. So पदغه کې bicuspid کې مطلب دغه normal valve په درې کسب لري او په دغه کې په bicuspid کې دوه کسب دي ځکه چې دغه دوه کسب چې دي دا یو بل fuse کیږي together forming دغه خالي two valves only. او دغه valve چې دا usually risk د aortic stenosis ډیر کوي او کله چې aortic stenosis risk ډیر شي نو aortic stenosis چې دا هغه hypertension risk ډیر کوي. So کله چې hypertension risk face up ډیر شي هغه hypertension چې دا هغه main cause of aortic dissection دا. So it's like aortic stenosis دا د hypertension risk ډیری او hypertension چې دا کنه in turn دا aortic dissection cause kei. So it's like that. So it increases the risk of, so in turn eventually increases the risk of aortic dissection. And then balio da pake coaction of the aorta, and this is basically narrowing of the aorta. So this is the coaction, this region here, like coaction of aorta matlab da also genetic da usually Turner syndrome kida, and delta the area the aorta چې دا تنګواله base up of aorta means coaction of the aorta the area of aorta چې ځان تنګ کی. So it occurs mainly after the aortic arch. So when pumping blood into the aorta, because a tiny area of the aorta has become narrowed, the blood has to squeeze through this tiny area. The blood has to basically squeeze through this tiny area of aorta, and it will create a lot of resistance. So the pressure in the proximal region where the occlusion gonna cause the blood pressure to rise. So pressure in this area, it will lead to hypertension and again increase the risk of aneurysm or dissection. As I said, it's common in Turner syndrome. So again, that tangwale chida da pressure pa daga area ki dir kai. Kala che pressure pa daga area ki dir shi no delta hypertension cause shi, and again as a result of hypertension pa daga area ki it increases the risk of dissection. And again, connective tissue disorders chidi like Marfan syndrome. Or like Ehlers-Danlos syndrome. So this is example of Marfan syndrome. So it was just interesting for me. So I thought I might just share a picture of it because so it's more it's better that it's visually appearing. So Marfan syndrome is a connective tissue disorder, and it's characterized by defect in the fibrillin, which is a glycoprotein, and it actually leads to decrease in the elasticity of vessel wall, and this can lead to aneurysm, which can again potentially predispose a person to dissection. So Marfan syndrome mainly elasticity, the vessel wall elasticity sada compromise kigi, or kala elasticity compromise shi matlab wall weak shi, yani aga high pressure withstand ki. As a result aga again dissection ta cause ki and aga aneurysm harm cause ki. Ehlers-Danlos syndrome ki matlab defect is in the collagen, and collagen is actually responsible for the resiliency of the blood vessel. Like it gives the ability to resist high tension and high blood pressure forces. So Ehlers-Danlos syndrome چې د یو بل connective tissue disorder ده چې هغه هم genetic ده او هغې کې collagen mainly affect کیږي. So کله چې collagen affect شي مطلب زموږ vessel wall چې ده هغه high tension and high blood pressure forces نشي withstand کولی. No, as a result it will again make it more prone to dissections. And other causes can be, in example, professional weightlifting, and also tobacco smoking, or example, drugs such as IV use of cocaine or amphetamines. These can also increase the risk of dissections. So in terms of clinical signs, so there will be a severe chest pain that will radiate to the back, and this is usually described as a sharp ripping or tearing in nature. So a chest pain of this nature is classically usually involve the ascending aortic dissection. And if you have like neck, or jaw pain, then dissection may be associated with the region of aortic arch. And if it's like a interscapular pain, then it's likely to be associated with descending aorta. So aortic dissection की जुदा पके severe chest يعني دير شديد chest pain पके पैदा की आगा زمون شاطة هم زمون back أملاط هم radiate كيجي और pain characteristic जुदा मतलब sharp يعني تيز غند دا it's ripping and it's very tearing in nature أو بل كexample chest pain example aortic dissection كده ascending aorta ki occur shi like no aga areas characterized by a chest pain kacharta dissection per aortic arch area ki पैदा shi no aga كده mostly خلق جديد या the neck pain experience ki या the jaw pain experience ki neck pain the غاري pain experience की या जो the alasho pain experience की और कलाचे dissection descending aorta की पैदाशी का dissection पर जमुंग descending aorta की no आगे के interscapular pain यानी pain जमुंगा the scapula mains की आगे region चदा आगे the interscapular pain way. And then there's also a pulse deficit and also blood pressure difference. So there's a symmetric blood pressure reading, which means classically associated with type A aortic dissections, secondary to the compression, occlusion of the left subclavian artery, or it could be and there's a example a difference of more than 2 millimeter mercury in blood pressure between the limbs, and there's also going to be a weak, or you can say an absent central pulse or peripheral pulse. So central pulse can be like carotid, subclavian arteries, or peripheral pulse such as radial, dorsal, pedal pulse, as compared to there will be a difference in the pulse as well as compared to the contralateral side. So one side of the example pulse difference aortic dissection की चदा आगे के pulse difference ही और आगे के blood pressure difference हमी example زمونگا خيغارة دلاس and زمونگا جبغارة دلاس كي example ka dissection left subclavian artery affect ki يعني ka dissection compression of يعني left subclavian artery ka seki ka occlude ki ka आगे के बंदिश पैदा की because left subclavian artery चदा आगा زمونگا arm ta blood supply की ka example left غارة affect شي alta occlusion पैदा شي no alta فشار blood pressure चदा alta कमी نسبت دي زمونگ خيغارة نا no خيغارة की فشار like say normally and chabgara ke fishar kami. So this means that there's a blood pressure difference. And okay. So alta pressure difference or pulse hum difference example per chabgare ki pulse weak khari nisbat dikhi gari na, and the reason is that chabgare ki occlusion occur ki this the artery, the branching artery, and khigare ki is not being occluded. And also another factor chida aga hypertension da. It may be spurious due to branch vessel occlusion, or it be a sign of cardiac tamponade, aortic regurgitation, hypovolemia from the aortic rupture. So hypertension jida aga occur kigi as a result of kalachi dissection, aortic dissection, kalachi dissection tamponade cause ki, aortic regurgitation cause ki, ya dari complication hypovolemia, no the agi the result na dari the vagina hypertension occur kigi. And this is like a normal chest x-ray. So for aortic dissection the chest x-ray shows a wide mediastinum, so it's basically above 8 centimeters, and this is a CT scan. So normally this is the true lumen, this region here is the true lumen, and this is shown as the false lumen of the aorta. So this is how it looks on a CT scan. Per CT scan ki a dissection chida daga sikhkari dagal the true lumen the true lumen matlab khpala the aortic lumen or false lumen matlab aga lumen chida as a result of dissection formed shweda between the tunica intima and tunica media region. So in terms of complication, just give me a second. So in terms of complication, as you mentioned, that the malperfusion syndrome is one of the, is like the series, the main complication, one of the main complications in aortic dissection, and it is defined as defined as the loss of blood supply to vital organs, which is caused by branch arterial obstruction secondary to the dissection. And the malperfusion syndrome, it's caused by static or dynamic obstruction. So static obstruction, it's any fixed obstruction of the true lumen, and in most cases, the static obstruction is caused by extension of the false lumen into the branch vessel and subsequent thrombosis of the false lumen. And dynamic obstruction may actually, this is the dynamic obstruction, which may arise due to intermittent occlusion of the branch vessel. So by when this false lumen protrudes into the ostium of the vessel. So malperfusion syndrome كده آغا مطلب يعني كلا dissection occur شي for your example dissection let's say ضغلت پیدا شي which is close to زموږ renal arteries there dissection کا celiac trunk کې پیدا شي یا mesenteric arteries کې پیدا شي ضغلت کا dissection پیدا شي نو آغا زموږ په دغه طریقې سره په static obstruction and dynamic obstruction طریقې سره آغا زموږ دغه branching arteries چې دي کنه آغا constrict کوي نو دا branching arteries چې constrict شي هغه مطلب blood supply چې دا دغه organs د kidneys ته یا blood supply زمونږ که inferior mesenteric artery affect کی blood supply مطلب زمونږ abdomen ته bowel ته یا کسي هغه الته compromise کیږي example که دغه regions depending کوم region دا dissection affect کوي نو الته blood supply compromise کیږي او هغه like complications cause example in case of kidneys هغه complications like acute kidney injury cause کوي یا ischemia of the bowel cause کوي که دغلته dissections occur شي او په دغه aortic dissection چې دا کنه په دغه طریقې سره obstruction cause کوي the branching arteries obstruction cause کوي so کله چې static obstruction یا static obstruction یا dynamic obstruction so کله چې static obstruction معنا false lumen so it's basically any fixed obstruction of the true lumen. So this is when the false lumen, the false lumen propagate can travel the branching areas da and the hematoma form K, and as a result the true lumen the section the branching artery da constrict K. Let's just say the section the your branching artery da, or we can say the renal artery da. So the section the renal example renal artery da no په دغه طریقې سره دوه طریقو سره occlusion occur کیږي یو static obstruction یا dynamic obstruction so په دغه کله چې دا false lumen زرم دغه سنورم غټ کی دغلته hematoma form کی like hematoma مطلب pool of blood form کی دغلته نو د دې د وجنه دغه area چې دا the arterial branch هغه constrict کی کله چې دغه example دغه area constrict شي example of the renal artery constriction of blood supply زمون kidneys ته کم ورزي and یو بل طریقه دا dynamic چې موږ ورته dynamic obstruction why so this is occlusion of the branch vessel by the protrusion of the intimal flap so دغه false lumen دلته دا کله false lumen چې خپل ځان protrude کوي دغه ستا branching aorta branching artery of the aorta like دغه په دغه طریقې سره دا false lumen branching artery بندي and it also results in occlusion and eventually compromisation of blood into the organ so so furthermore classifications example in case of if malperfusion occurs in the false lumen it starts like compressing for instance the coronary vessel a branch of the aorta and this could end up with acute coronary syndrome so in worst case leading to MI malperfusion example per coronary vessel affect ki dissection ka coronary vessel occlude ki region occlude ki the aorta no it can lead to coronary syndrome it can eventually lead to MI as well. And also another problem is the cardiac tamponade. So cardiac tamponade in this case it can form when aortic heart can form when aortic dissection ruptures into the pericardial sac, and it rapidly fills the pericardial sac, and the blood-filled pericardium it compresses on the ventricles, and it does not give the ventricles enough ability to contract and get blood out of the heart, and therefore it's causing low blood pressure, jugular venous distension, or distant heart sounds. And this is known like Beck's triad. So cardiac tamponade the أهم complication the dissection or cardiac tamponade كده delta سكوسكي كدلتا example dissection rupture شي no blood شدا غطى pericardial sac كي سكي accumulate كي كلش blood pericardial sac كي accumulate شي no أغيت مونغا cardiac أغيت مونغا cardiac tamponade و no دلتا شكل blood accumulate شي ventricles مونغا the heart chambers affect كي like نبري ديك شي heart chambers contract وكي سي طريقي سرا داغي يعني خبل normal function perform كي أو داغي دي وجهنا example hypertension occur ki kalache ventricle say like pericardial sac delta blood build up shi the ventricles among the right side and left side and all the chambers of the heart da aga compress kai no ventricle say nishi contract kawala and so they cannot undergo like systole and diastole properly, and as a result delta hypertension occur ki. So hypertension occur ki because of cardiac output aga decrease ki when the left side of the ventricle, when the left ventricle is not able to contract properly, it can lead to decrease in cardiac output, and as a result hypertension cause ki. And similarly jugular venous distension cause ki because right side of the heart the aga nishi accommodate kawale venous return, so venous return is not being accommodated, and therefore it leads to jugular venous distension and also distant heart sound. So heart sound, so or you can say muffled heart sound ham cause kai or complication to dissection to the stroke da. So kalache dissection when it propagates and causes occlusion of the vessels which come off the aortic arch, example the common carotids, that branch into the internal carotids, so dissection and supplying the brain. So due to this occlusion there will be a decrease of blood flow to the brain, and this will cause stroke. So dissection example per carotid aortic arch region ki occurs ki kadaga region ki example dissection occurs ki kadaga area ki like carotid arteries affect ki no aga zamunga brain like it affects the blood supply to our brain yani aga zamung blood supply brain to affect kai matlab kadalta example occlusion pedashi no aga cerebral hyperperfusion cause kai, and as a result stroke ham cause kai kadaga aortic arch ki daga ziki ka dissection pedashi, and dissection matlab دغلت السورية پیداشی نو دغلت كسورية پیداشی or the areas on dissect ki, and eventually the area so she occlude she and compress she the artery, the branching artery, and this will lead to eventually the hyperperfusion of the cerebrum. So cerebral hyperperfusion will occur, and eventually leading to stroke. The acute limb ischemia da. So if example left where is the like acute limb like a limb ischemia to the if dissection occurs in the limb region like munga sangacha mentioned ka subclavian arteries ke left aortic dissection occurs no alta it's likely to cause ischemia of the left side of the arm. And also acute kidney injury one of the complications and this is when so if the dissection propagates and causes malperfusion of the kidney, or its occlusion again causing decrease in the blood flow to the kidneys, so this will lead to low urine output, which means that not getting rid of waste metabolic products, and it can lead to acute kidney injury. It will lead to decrease in GFR, and less filtrate is coming to the kidneys due to low blood volume. So example occlusion of renal arteries occurs no agazim kidneys affect kidneys بدغي ساب affect أغلتك blood supplies من kidneys تو نرسيجي no alta low blood volume and alta low blood volume hypokidmung kidneys ki, and as a result of low blood volume, aga zumung GFR decrease ke, GFR decrease no metabolic kidneys chida aga cannot get rid of the metabolic waste that's being produced and filtrate chida aga decrease kigi. So there's less is being filtered through the GFR zaka chizum GFR ham decrease kigi, or urine output ham decrease kigi. And dissection example, a mesenteric artery affect kino, as we mentioned, aga bowel ischemia cause or you can say so if it also affects, example, the celiac trunk, it will occlude the blood flow through the GI tract, which might lead to ischemia, example, acute mesenteric ischemia, and it's characterized by intense abdominal pain, bloody diarrhea, and due to bowel infarcts as well. So if the dissection affects the mesenteric artery, ka dissection mesenteric artery affect ki ya celiac trunk affect ki zumunga bowel ta blood supply ki ka aga region affection no blood supply chi da zumung bowel ta compromise ki and eventually aga bowel ischemia cause ki. Or paraplegia da ham your consequence da. So this occurs if there's obstruction of Adam-Kiewicz artery. So this artery here that you can see, if there's obstruction of this artery due to dissection. So this means that less blood will flow through the anterior spinal artery, so through this artery. So blood is then not supplied to almost 2/3 of the spinal cord, and this can lead to anterior spinal artery syndrome, and this will lead to weakness and potentially paraplegia. So paraplegia is basically inability to voluntarily move the lower parts of the body, and it can also lead to loss of sensation. It can lead to incontinence as well. The dissection, aortic dissection, daga branch the aorta affect, which is known as the Adam-Kiewicz artery. It's also known as the medullary artery. Daga area chida kana da 2/3 of a spinal cord supply. Daga area affect chi, daga area daga branch affect chi. No da sakay da sabab de paraplegia garzi matlab da weakness cause kai pesap, and yeah, like bada paraplegia matlab weakness cause kai, loss of sensation cause kai, and also incontinence yani urinary problems with urination aga cause kai. So that's. And also in terms of management, so medical treatment is actually used in the initial treatment and stabilization of patient. So with all types of aortic dissections, it may be a sole treatment for uncomplicated type B dissection, and all type A and complicated type B dissections should be considered for immediate surgery. So it basically, the medical treatment is obviously to control the underlying risk factors, like quickly lowering the blood pressure. So maybe systolic BP should be 200 or 120 millimeters mercury, and target heart rate should be between 60 to 80 beats per minute. And also administration of IV morphine for pain control, intravenous beta blockers, infusions such as labetalol, propranolol is the first line agent, or second line agent, example IV calcium channel blockers, yeah, IV nitrate infusion. So invasive treatment, like urgent surgical intervention, is the treatment of choice in majority of patients with type A dissection, and the surgery will involve removal of the ascending aorta with or without the aortic arch, and also replacement with a synthetic graft. And complicated type B dissections are also defined as those that have more than one more than one complications, like they have end organ malperfusion, they have rapid aortic expansions, a refractory chest or back pain, uncontrolled hypertension, despite adequate pharmacotherapy, or signs of rupture such as hemothorax occurs as well. And treatment options for complicated type B dissections include endovascular stenting of the aorta. So basically, invasive treatment usually type A dissections के ज़्यादातर इस्तेमाल की invasive treatment मतलब surgery type A dissection usually involve कई. So ज़िक्र type A more dangerous ज़िक्र type A ascending aorta affect के संगच मुंगा earlier discuss ओको that कलच ascending aorta affection वागा coronary arteries मुंगा affect के, leading to compromisation of blood to the heart itself, and eventually can lead to MI. So type A did a serious type da. أو دي surgery بدغة example كدغلت example dissection إنه ده ascending aorta ده type A Stanford classification كده ده type A ده. Oh, the surgery, like what they do is that they you stent replacement. So this is just out of interest. I put this here. This is how they perform the surgery. That they remove this area. The section, the dissection section, the area did remove kay, and avoid the artificial grafts that they replace kay. So, or they also undergo stenting, or usually type B Stanford classification kichimunga uwela type B chida aga descending aorta affect kai, or kalache type B type B Stanford such that type B che kala sashi complicated type B dissection no aga halaki surgery undergo kai complication for type B example in malperfusion and organ malperfusion include kai rapid aortic expansion include kai yaka uncontrolled hypertension ya refractory chest pain no padaga halatun ke so it becomes it fulfills the requirement for surgery if there's a complicated type B dissections. And this was all from the aortic dissections. So now we are going to move on to the aortic aneurysms. So for aortic aneurysm, this is usually so the word aneurysm, it comes from the Greek word aneurysma, which means dilation. And this makes complete sense because aneurysms, these are defined as abnormal dilations in the blood vessel. And aortic aneurysms is a local dilation of the aorta, which is by over 50% of its normal diameter is being affected. So normally aorta has a thick wall, again, as we mentioned in the aortic dissections, okay, that so the aorta has a thick wall, and this is basically to withstand a high pressure of the blood. And over time, the wall of the aorta becomes weakened, slowly bulging outward like a balloon. And so when a blood vessel wall weakens, it struggles to contain the pressure of the blood, and therefore it pushes against the wall, so the diameter of the blood vessel lumen increases. And also, according to the Laplace law, which it says that increasing the diameter increases the pressure of the wall of the blood vessel, and this makes the aneurysm diameter even bigger and creates a cycle of continuous bulging, basically. So aneurysm chida agad yo Greek word narazi chiwarta munga aneurysma way aneurysma matlab yani dilation yani zan this a parcel يعني دغا area دغا segment the region the aorta chida da persigi يعني dilate كيجي زان dilate كيزان غت كي and usually chida da the day waja da the kalachi munga sanga pa aortic dissections which kalachi da wall weakness pedashi pa da areas ke no as a result of wall weakness because aga wall kalachi weak shi aga high pressure the aorta no withstand ke chikala high pressure the aorta no withstand ke no the agi the wajina da area bulge out ki da area zan per se zaka chika da wall weak shi or chun pa aorta ke pressure chida der zyada or kalachi da walls the walls kadilta the weak shi kada walls zaif shi no as a result of that aga high pressure delta nishi contain kawale and aga dilation cause ke aga the wall dilation cause ke or as Laplace law suggests that kalache diameter increase kigi no aga zan sara pressure hub increase ke per wall bande and it's like a positive loop. It's like a positive feedback loop. So if there's like a increased diameter, what it does is that it increases the pressure hum increase kai or the pressure in touch that bit the diameter increase kai. So this is like a positive feedback loop. It's like a positive feedback loop. So if there's a kakalachi delta diameter, the aorta, the segment, the region delta diameter ghatshi, no matlab the increase, it causes increased pressure, right? It also increases the pressure in this region, and kalachi the pressure dishi, it again the increased pressure in turn causes again further increase in the diameter of the aorta, and this is how it continues, like in a positive feedback loop. That's how it continues. And usually aneurysm chida aga khali per aorta ke na appear kigi aga. You can also find aneurysm per femoral arteries ke ham peda kigi, ya per iliac arteries ke peda kigi, ya per popliteal arteries, cerebral arteries ke ham peda kigi aneurysm. But it's more common in the aorta, but aorta ke dear common the aneurysm, so it's not the only point. And also in terms of its classification, Chida. So aortic aneurysms, there are also two major categories. There are true aneurysms, as you can see. There are also pseudo aneurysms, or you can also call them like false aneurysms. So in true aneurysm, all layers of the blood vessel walls dilate, so all layers, and true aneurysm that balloon out symmetrically on all sides of the blood vessel wall. These are called the fusiform aneurysm. So this is the one, and they're the frequent types. However, when there's asymmetrically shaped aneurysms, like this one here, that balloon out on one side of the vessel wall, these are called dissecular, you can say baryaneurysms, and this is asymmetrical in shape. And it usually happens because for some reason, like one side of the vessel wall experiences higher blood pressure than the rest of the vessel wall, or because the wall was weaker on this side compared to this side. So even per aortic aneurysm chida, there are two categories that you true aneurysm, the pseudo aneurysm, the matlab false aneurysm, yani naqli aneurysm. For true aneurysm kichda, the tool layers, the vessel chidi, the aorta, the tool layers like intima, media, adventitia, the tool layers asakigi, zan yo ze dilate ki tool layers affect ki, yani daga tool as involved ki, all of these layers being affected. And with the symmetrically or kalachi a fusiform, specifically fusiform chi matlab the aortic vessel wall the dwara walls like am daga gara na da sakizan gatizan dilate kai. So per fusiform ki matlab the vessel wall chida the aorta the dwara garo nazan sakai like aneurysm chida dilation am daga gara affect kai, am daga gara affect kai, so dwara garo daga se persigi. Lekin persacular chida ya very aneurysm chida aga khali yo side the vessel wall saki gatigi. So yo side aga usually yo side zaka gatigi zaka cheki yo side daga side ki the vessel wall chida da did weaky compared to daga side ki the pressure diri no daga gara did saki daga like dilation paida ki, zefto paida ki. And also normally chida thrombus formation chida thrombi formation a blood clot aga padaga ki dir commanda padaga saccular ki usually dir commanda formation of the thrombus zaka chida the pool of blood da no delta thrombus formation dir commanda. Or well, there is also pseudo aneurysm. ممكن ورته هم false يعني نقلي aneurysm ورته هم way because أقوله real درس real aneurysm ندا. They are caused when there's a small hole in the blood vessel, as you can see. And there is a small hole in the blood vessel, and due to the small hole in the blood vessel, this allows the blood to leak out of the vessel and form a pool of blood that looks like a fusiform or a baryaneurysm, depending on where the hole is and also depending on its size. And this pool is usually surrounded by the surrounding tissues, which act as a wall that contains the blood in one spot. So pseudoaneurysm chida kala example kadalta surei the area ke no the aorta na blood chida through the surei dalta leak out kigi dalta leak out shino dalta dakhpala yo sazan and yo bulging peda ke yo bulging form ke, and the bulging chida aga cover shivida, like it's covered, the bulging is covered by the surrounding tissue. The surrounding tissue shidi like adventitia aga daga pseudo aneurysm sakai cover kai. Okay, so the difference like a daga dissecting aneurysm da or the pseudo aneurysm da. So example for dissection ki chida mungu uela chida tunica intima layer nada daga khali sada tunica intima layer chida aga khali agi ki sure paida shivida no the aga ذكا دا فينا كده دا ايوتانا دا tunica intima or tunica media mensky collect kigi. So da example aortic dissection da lekin padare ke كده it completely leaves the blood vessel the aortic wall and pseudo aneurysm كده aga the blood completely leaves the tunica, like the piercing كده da it's basically the cut is made like the cut also involved the media and the tunica intima and not only the intima. So that's why the blood completely leaves the blood vessel wall of the aorta in this case. And the fusiform aneurysm da dare per dare common da per abdominal aorta section ki da alta da dare common da. So classification based on the location. So normally arterial aneurysm, they occur more commonly in the aorta, with about 60% of them being true aortic aneurysm, which is happening in the abdominal section of the aorta, and the 40% is happening in the thoracic section. So in thoracic aneurysm, so it's anatomically defined as any aneurysm occurring in the portion of the aorta which is located above the diaphragm, and this is further subclassified depending on whether it's localized on the ascending aorta, the arch, or the descending one. However, the ascending aorta is the most common type. So per thoracic aneurysm chida aga dagal the as already marked by this blue frame. The thoracic aneurysm chida aga so above the diaphragm, the diaphragm na pass che come aneurysm koskigi no agita mga thoracic aneurysm. Well, example ka aneurysm pa ascending aorta ke koskigi daga region ki, ka aneurysm pa aortic arch ki koskigi, ka aneurysm pa daga descending aorta ke koskigi. Lekin da maqsad the diaphragm na pass ligusi, the diaphragm na pass chi no agita mga thoracic aneurysm wayu, and diaphragm na landi chi agita mga abdominal aortic aneurysm wayu. No aga abdominal aortic aneurysm chida aga diaphragm na land prodda, and more specifically chida aga the abdominal aortic aneurysm more commonly pasa region ke form ki the renal arteries the renal arteries so usually abdominal aneurysm chida the renal arteries na land form ki so like around 80% to 90% of cases chida kana agadagal ta region ke form ki the renal arteries the land form ki or they were jada zaka che as you descend down the aorta delta elastic content and delta collagen content chida pa aorta ke agal leg is not much agal leg the delta collagen and elastic the aortic vessel wall ki leg da no zaka daga area dear prone ki che seshizan dilate ki azan ghat ki, because the weakness there say commonly kalache elastic tissue ni ya kalache collagen tissue ni the vessel wall khpala wikigi or kalache vessel wall weak shi no dalta da vessel nishika wala che da vessel wall nishika wala che da dalta high pressure the aorta siki withstand ki no zaka aga pressure the aorta che da aga da areas che da aga da areas dilate ki da areas ghat kai like a balloon ronte. These areas being, and again the risk factors for aneurysm is so what underlying conditions might weaken the wall of the blood vessels, and it's the ones that are mentioned here. So in hypertension again same concept singa chimunga pa aortic dissection ki wela che hypertension ki vasa vasorum affect kigi and vasa vasorum cheda singa chimunga vasa vasorum aga tiny like vessel wall, tiny blood vessels. So example kada let's just say the aorta. I'm really bad at drawing. The aorta da no da vasa vasorum chida da say these are like the vessels. These are like the Chimunga earlier described kana daos aorta da. And aorta passage da vasa vasorum so these are glued onto the aortic valve. No kalachi hypertension ushi no hypertension kichida vasavasorum چې دا هغه hyaline atherosclerosis develop کوي او د دغه vasavasorum چې د دغه tiny blood vessels چې د هغوی lumen سکیږي narrow کیږي ان د هغوی lumen تنګ کیږي هغوی د constrict کیږي because of atherosclerosis, and as a result it causes ischemia, and again the ischemia of this it basically leads to atrophy of the smooth muscles of the tunica media and overall weakening of the vessel wall, of the aortic vessel wall. So as we said that the vasa vasorum, when the blood is being compromised in vasa vasorum, the vasa vasorum نشي کوله چې هغه blood supply کې properly tunica intima layer ته tunica external layer ته نو as a result هغه ته blood supply سي ونه رسیږي نو هغه tunica media and tunica media هغه regions weak کیږي کله چې هغه regions weak شي دا هغه ټول vessel wall ورسره weak کیږي and as a result هغه more prone کیږي aneurysm occur شي او بل چې دا cause چې دا څه ده atherosclerosis ده. So the wall of the aorta it starts to change from being strong elastic to being weak firm hard less elastic artery and making it less able to deal with the blood pressure. And there's basically three main causes of arteriosclerosis. One is atherosclerosis, then the other so atherosclerosis where a bunch of plaque is being built up on the tunica intima layer. So this is the atherosclerosis is being built up on the tunica intima layer in this area. And what this does, it is that it basically makes it difficult for the oxygen to penetrate all the vessel wall. کله چې دلته plaque پیدا شي نو oxygen چې دا ډېر په مشکل سره vessel wall penetrate کې مشکل سره دلته رسیږي because increases the distance. And another reason is the calcification of the vessel wall, where the calcium builds up on the wall of the artery as we age. Usually it's common in the elderly people and old people, and also third reason to that chronically elevation of blood pressure, and it can also cause arteriosclerosis as high blood pressure causes the thickening of the medial layer. So arteriosclerosis مطلب چې دا یعنی د خپل د artery شختوب یعنی داغي weakness یعنی کله چې artery خپل ځان hard کوي هغه elastic less elastic and ډېر firmy او ډېر hardy هغه ته موږ arteriosclerosis وایو او هغه like three causes arteriosclerosis like three causes لري یو د چې ما ویل atherosclerosis دا کله چې plaque build up کیږي plaque چې په walls کې build up شي نو هغه داغي د وجنه oxygen صحیح چې دا په صحیح طریقې سره زموږ vessel wall نشي penetrate کولای او دویمه وجه دا calcification of the wall کله چې calcium په walls کې د aortic vessel wall کې څه شي deposit شي کله چې calcium build up شي د aortic vessel wall کې او دا usually په elderly خلکو کې کېږي یعنی خلک لږ زړو کې دا ډېر common ده. And also dream reason the atherosclerosis چې دا هغه elevated blood pressure دا کله چې blood pressure ډېر زیات شي هغه atherosclerosis cause کوي because high BP چې دا هغه intimal layer thickening of the intimal layer cause کوي. So it thickens the intimal the tunica media of the aortic wall, high blood pressure, so that's why it causes aneurysm. And also we mentioned, so basically the aortic aneurysm, the aortic dissection and the aortic aneurysm risk factors to the aga پیوسا یو رقم دي because yeah, and genetic factors again Marfan syndrome da or Ehlers-Danlos syndrome, Marfan syndrome, so it weakens again the blood vessel wall because elastic properties found within these are impaired, and again Ehlers-Danlos syndrome it also are more likely to develop aneurysm because the ability to form collagen proteins is disrupted. So Marfan syndrome again چې موږ دا genetic disorder دا په دې کې vessel wall weaky ځکه چې دې کې elastic properties چې دې کنه هغه compromise شي بیا هغه elasticity پکې زیات نه په vessel wall کې نو ځکه vessel wall پکې ضعیفي په Ehlers-Danlos syndrome کې چې دا هغه defect in collagen protein so دا په Ehlers-Danlos syndrome کې چې دا collagen protein کې defect دي so مطلب collagen there's not enough of collagen or zaka again vessel wall weaky or collagen, as we mentioned, collagen چې دا او elastic fiber elastic proteins چې دي we main components دي د زمونږه tunica externa and tunica media او که دغه connective tissue پکې compromise شي یا دغه connective tissue پکې نی یا کمبود دي نو هغه overall vessel wall weakness پیدا کوي او چې vessel wall weak شي هغه هم aortic dissection cause کوي او هم aortic aneurysm cause کی because vessel wall چې weak شي again هغه نشي کولای د aorta چې a high pressure withstand کی. So again, as we mentioned that advanced age, so over 60 is a risk factor because older people, they tend to have a stiffer aortas, partially because of calcification of the walls of aorta and partially because of more degeneration of that collagen and elastin over time. So په elderly خلکو کې چې دا خلک چې لږ زاړي د شپېتونه چې لږ عمر زیاتي هغه خلکو کې د هغوی normally aortas چې دي هغه لږ stiffy لږ hard غوندي mainly ځکه چې هغه calcify لږ calcium هغه aortas کې deposit شوي یا هلته degeneration هلته collagen یا elastin کمبودیت همي نو د دې د وجې نه د هغوی vessel wall ډېر زیات like normally weaky. Also, again, vasculitis, same risk factor as the aortic dissection. No vascular like Takyasu arteritis, giant cell arteritis, no the example, the inflamed they cause inflammation within the connective tissues of the aorta, so leading to degeneration and again predisposing of the patient to aneurysm. So again, dido التهاب cause pasake vasovasorium area and that means the blood supply to the ستاسي طريقي سره نورزي tunica intima and tunica media that's composed that's made up of connective tissue اغلتا سي blood supply نورزي نو ځکه هغه degenerate کیږي هغه weak کیږي and هغه more prone کیږي to form aneurysm as well. So yeah, like tunica media and tunica intima چې دا هغه چې کله د vasovasorium inflammation as a result په tunica media and tunica intima کې چې د الته fibrosis occur کیږي scarring of the wall هم occur کیږي because inflammation دا ټول د inflammation د وجې نه دا کیږي these fibrosis scarring occurs as a result of inflammation to the wall. And therefore the blood supply is compromised and the wall is weakened as well. And other risk factors like smoking and especially aortic aneurysm are common for male gender common Sariano common aortic dissection. So in terms of complication so in thoracic aneurysm specifically, it's a very serious complication and it can occur if the aneurysm is right above the aortic valve. As the aneurysm dilates, what happens is that it pulls on the walls around the aortic valve and it prevents the aortic valve from closing properly. And this allows the blood from within the aorta to flow back into the ventricle during the ventricle diastole. And this particular condition is called aortic insufficiency, or you can also call it regurgitation, aortic regurgitation. And another complication is that this will also cause a high-pitched brassy-like cough, and this is because of left recurrent laryngeal nerve which wraps around the aorta, and if that's being stretched by the expanding diameter of the aorta. So normally per aortic dissection the serious complication aortic aneurysm not dissection kala che aortic aneurysm ka example the aortic aneurysm example په دغه ascending aorta دغه area چې دا ascending aorta دغه area aortic valve and کله چې aneurysm په دغه area کې occur شي نو دغه area چې دا ډېر close دا ډېر close proximity کې دا aortic valve دا ډېر نږدې دغه area نو کله چې dilation aneurysm دغلته occur شي نو دا چې دا aortic valve دا wall دا ځان سره stretch کوي دا چې کله ځان سره stretch کی نو مطلب دا aortic valve چې دا په صحیح طریقې سره نشي close کېدلی کدا دلته د انیورزم که form شي د aortic valve د wall نی دا ځان سره stretch کی دا as the aneurysm forms as the dilation occurs نو دغه valve ځان سي نشي بندولای او دې ته موږ aortic regurgitation وی مطلب وینه چې دا دینه چې بیرته د aorta نه to the rest of the body lash instead of the blood being pumped to the body دا وینه چې دا د بیرته back flow کوي ventricles د بیرته back flow کوي because دغه aortic valve په صحیح طریقې سره نشي بندیدلی due to pull on the aortic valve ځکه چې دلته دا aneurysm چې دا دغه aortic valve region یې ځان سره stretch کړی دا wall د aortic valve یې ځان سره stretch کړی دا او دغه green که ګوري دې ته دا recurrent laryngeal صدا nerve ده او کله چې دغه area دغه aneurysm سره دغه area دغه nerve هم stretch کیږي کله چې دا nerve stretch شي نو دا یو رقم cuff cause کوي یو رقم ټوخی cause کوي چې هغه example high pitch دي او هغه brassy په nature کې so I don't know what brassy means in Pashto but yeah. And also, in case of symptomatic thoracic aneurysm, they're most commonly present with chest pain that radiates the back, or symptoms related to compression of nearby structures leading to nerve dysfunction or vascular compromise. Example, compression of the esophagus will cause dysphagia, while compression of the trachea may cause respiratory difficulties. And also, example, superior vena cava syndrome can also occur where the blood supply through the superior vena cava is slowed down. So, for symptomatic thoracic aneurysm ki chidi aage ki normal chest pain is zyatar pake one of the symptoms the thoracic aneurysm chida aage chest pain da chi aage zamung amlat shat ham radiate kai او another complication دا چې هغه کله چې aneurysm occur شي هغه ځان سره دا نور nearby دغه څنګه چې د aneurysm څنګه چې دا نور structures یا tissues هغه ځان سره compress کوي ان هغه ځان سره هغه area ځان سره تنګ کوي او example کا esophagus کا example دلته esophagus پروتي دغه area کې دلته esophagus او که aneurysm دغلته occur شي نو هغه esophagus چې دا زموږ هغه esophagus compress کوي مطلب when کله چې یو area ځان dilate کوي نو هغه example another structure compress کوي so example esophagus که compress کوي نو د هغې د وجې نه dysphagia cause کوي یا که example trachea compress شي as a result of aneurysm as a result of this dilation نو هغه respiratory difficulties cause کوي example superior vena cava so she compress she no aga difficulties cause ki blood per superior vena cava ki so she normally it makes basically blood flow through the superior vena cava very difficult and for abdominal aneurysm ki like one of the most characteristic symptoms to this or signs is pulsating mass that can be felt to the midline of the abdomen, slightly to the left, and compression of the nearby nerves can cause abdominal or lower back pain. And if aneurysm is above 5 centimeters in diameter, it may be palpable if examined, and they're frequently tender, especially when expanding rapidly, and murmurs may be audible over the abdominal aorta. So murmur is also audible over the abdominal aorta, and usually surgical repair is also indicated for aneurysms that are usually greater than 5.5 centimeter in size in the abdomen. And another complication is that when aneurysm, it can compress the neighboring structure, like in case of aortic abdominal aneurysm chida, the compression can occur in the vena cava example, and this will decrease the venous return. So if this is like the aorta kada aorta and daga example this sanke dalta da vena cava دغلطه sanke or sorry vena cava چې دغه area کا دلته د aneurysm چې ارسل د dilate شي the more it gets dilated the area the aneurysm section چې dilate شي نو دا ځان سره دغه vena cava دا چې vena cava نو دا دغه vena cava compress کوي کدا اسمه چې دا dilate کې د aneurysm چې ځان غټي and the dilation پیدا کوي نو دا ځان سره دغه nearby structure compress کوي دا چې compress شي نو دا venous return سكي decrease كي دغا situation شدا أغا thoracic aortic aneurysm تهم apply كيجي كالتش example also like in terms of delta trachea delta trachea or delta example let's say delta thoracic aneurysm. So if there's a bulging of you know, like here, and this is the trachea كدلتا example as a aneurysm زان غتكي نو دغا trachea كي that trachea زان سرا compress كي or that respiratory difficulties cause كي. Excuse my drawing is actually really bad, but yeah. And then also, as we said, that usually kata aortic aneurysm ki chida kamas de 15 centimeter na ziyati per diameter ke da the aneurysm chida the aneurysm the area the dilation area ka de 15 5 centimeter na ziyati no that visibly usually that visibly so easy to feel ka wala shay. So during abdominal examination it can be palpable, it can be easily felt as well during examination of the abdomen, or murmur hamdilta the easily auridala shay. So with your stethoscope you can easily listen to the murmur as well in this section. أو كتشرتا the aneurysm delta دا the 5.5 na زيادة in centimeter no بدغة حالت كي surgery require كي aneurysm يعني دا dilation زيادة but the 5.5 na no دا surgery require كي. And also another risk كدا thrombus formation دا so what happens is that if the thrombus can actually form, example, for aortic aneurysm, the abdominal aneurysm, the intraluminal thrombus forming. So as we have said, like this is thrombus can occur here at this point. And what that happens is that moreover, bits of thrombus can actually break off, or you can say can embolize and float around the bloodstream, the circulatory system. And this is an issue as the small emboli can get stuck in the smaller vessels and cause ischemic damage. So kalachi thrombus form she another complication, the aneurysm chida thrombus formation, the example intraluminal thrombus dear common da pasake abdominal aortic aneurysm ke no kala thrombus form shi no kada agina like bits break off shi ka thrombus kan barkha break off shi agita munga embolism way no aga embolism chida like daga, let's say this is thrombus, and then part of this breaks off, then like daga section break off kigi like daga small bits, or daga section chida kana daga da embolism da. And the circulatory system this can the circulate bloodstream ki da circulate kigi or the small thrombus da lara peda kiche the small emboli da lara peda kiche small vessels small arteries aga occlude ki small arteries ki bunch example aga ischemia ischemic damage of those small arteries cause ki. That's. And then the most severe complication is rupture. So the surgery main reason chada aga data che rupture prevent ki. So pa aortic aneurysm ke chikala surgery zaka kaya which aga prevent ki rupture from occurring. So it's one of the main concerns of aneurysms, and usually kacharta rupture occurs show no prognosis pakadir poor e. And rupture can actually, when they can rupture in case when basically means that it pours the blood out of the aorta and into the tissues in the abdominal cavity, and this means that less blood is there to provide you with oxygen. So eventually leading to ischemia of tissues due to oxygen deprivation. And if it's not treated on time, that's what it can happen, like can lead to ischemia of the tissues if it's not treated on time. And also if ruptured, it can lead to hypertension because blood leaking out of the circulatory system, so blood pressure can't be maintained. And also tachycardia can occur as a compensatory mechanism for the low blood pressure, so trying to work harder, so the heart is trying to work hard and faster to move the blood around the body. Another problem with rupture can also be syncope. Syncope is like fainting, and this is if blood pressure is not maintained. This means that the blood may not be able to get up into the brain, and cerebral hyperperfusion will occur. And as a result of cerebral hyperperfusion, you will get syncope. So कलच rupture कलच rupture the aortic aneurysm की rupture occur शी मतलब no blood chida so the aorta leave the blood aorta break the or nearby tissues to the and surrounding tissues like it leaves the basic the blood leaves the aorta and أغيد وجنا no hypertension هم occur كيجي زكاة when blood leaks out the circulatory system, the blood pressure the أغا نش maintain is not maintained properly. كالتش volume of blood per aorta ke kami hypertension هم cause كيجي as a result of the rupture زكاة blood is leaking out of the aorta and blood the circulatory system pretty and enter the nearby tissues and as a result it can lead to hypertension. Tachycardia هم occur كيجي and increased heart rate. A compensatory mechanism that in response to hypertension. No زمون heart the hard work faster beat كي and it works harder in order to move the blood due to hypertension. Or syncope هم occur كيجي كلچه मतलब if there's less blood in the circulatory system मतलब cerebral like less blood شده كان آغاز من brain تهم flow كيجي and as a result it can lead to cerebral hyperperfusion. So lack of blood flow to the brain it can lead to an آغا eventually syncope cause के मतलब a fainting cause के يعني fainting the बेहोशी cause के and usually شده thoracic aortic aneurysm chida, they may rupture into the pleural cavity and usually example the mediastinum or they can rupture in the pericardium, so again leading to rapidly development of cardiac tamponade or so ka example ka rupture the thoracic aortic aneurysm ushi no aga blood chida aga sata leak kigi blood chida pleural cavity ta leak out kigi ya mediastinum region ta leak out kigi or ka blood chida pericardium ta hum leak out kigi yani pericardium ta zi or aga da غير vagina cardiac tamponade occur kigi kala blood pericardium ta pericardial sac larchi chimunga pa aortic dissection ke hum explain ka when blood leaks out into the pericardial sac, cardiac tamponade cause ke cardiac tamponade occur no the heart the ventricles the aga सही तरीके से contract नहीं कवले no so the heart function becomes compromised. Oh, the vagina, we can see hypertension in cardiac tamponade. We can see jugular venous distension and muffled heart sound as well. Zakache hypertension because decreased cardiac output and jugular venous distension zakache the right side to the aga nishi accommodate kawale venous return. No, that's why it can lead to cardiac tamponade as well. And per aortic abdominal aneurysm chida, so if there's a rupture is present with acute severe tearing back or abdominal pain that can radiate to the flank, buttocks, legs, or groin. So depending on whether the rupture is intraperitoneal. So intraperitoneal means that within the peritoneal cavity, so the area that contains the abdominal organs, or if it's like retroperitoneal, so the area in the back of the abdomen, so behind the peritoneum. And nausea, vomiting, secondary to peritoneal irritation can also be present. And as mentioned before, severe blood loss and hypertension can also be present. Can you please give me 1 second? Just 1 second, please. 1 second. Okay, sorry, Alta. I had like someone knocking on the door, so I had to open it. Okay, so let's continue. Kalachipa, where were we? Yeah. So in aortic abdominal aneurysm, so rupture can occur in that area as well. So it's characterized by nausea, it's characterized by vomiting, and usually secondary peritoneal irritation can also be present. And so kalache rupture the aortic aneurysm per abdominal section ki e no aga the symptoms like also abdominal pain cause ki like flank pain cause ki flank amata no malum flank te pashto ki chishawi so ma da pictures pick up could you to this in the Google na flank the daga area the way daga area the flank way no the pain da kalache rupture occurs per abdominal section ke the aorta due to aneurysm no agache da abdominal pain cause ke yani our pain is severe did that na ke the area affect ke as well groins be ham affect ke or rupture the aorta the abdominal aneurysm chida aga usually rupture sa tawar ke intraperitoneal area the blood kalache rupture shinu the blood to the intraperitoneal area the leak kigi ya retroperitoneal area the ham leak kigi. So intraperitoneal area the area within the peritoneal cavity. So and the retroperitoneal area to the aga is the area in the back of the abdomen, so behind the peritoneum usually. And also Gray Turner syndrome, Gray Turner sign they can see here, and this is the colon sign. The sign that usually more common the pancreatic pancreatitis, but it may also be present in an aortic abdominal aneurysm as well. And it's usually represented by flank ecchymosis. Ecchymosis basically means bruise, which is caused by blood leaking from the broken, broken or ruptured blood vessel in the tissues of the skin. And this is secondary to blood dissecting between the facial planes and the retroperitoneum. So the bruising appears as purple or blue in discoloration, and it's usually seen in patients, as I mentioned, in pancreatitis as well. So Gray Turner sign the hump kalache abdominal aortic aneurysm rupture ushi no blood leak out the sana daga in the facial planes in the retroperitoneum no agad daga si yo sa kalache rupture she blood leak out no agad daga si yo sa bruising appearance worki. And also colon sign chida, this is basically characterized by periumbilical ecchymosis, and this occurs due to retroperitoneal blood extending into the periumbilical subcutaneous tissue. So colon sign kalache matlab daga area ke sashi blood leak out and the blood leak out the as a result of rupture blood leak out aga daga like periumbilical subcutaneous tissue that basically blood is leaking out in this area in the area of subcutaneous tissue or the periumbilical region. So these signs the hum coming deeper. These are common in aortic abdominal aneurysm due to rupture of the blood and due to rupture of the aneurysm and due to leakage of the blood into the subcutaneous tissues or into the facial planes, which presents this sign. And also in terms of management, so before management, we can talk about the diagnosis. So normally diagnosis chida kana per aortic aneurysm, aortic abdominal aneurysm chida aga usually used yani ultrasound warta istemal kigi in for diagnosis or CT scan hum istemal kigi and CT scan chida aga did see did usefully aga did useful information warki zaka chi aga accurately mungta a specific and accurate sizing of aneurysm muntakhi yani, and then chest x-ray chida example or chest CT angiography, these can be used for thoracic aortic aneurysms in order to diagnose them. So as you mentioned that in chest x-ray what happens is that it's not a definitive diagnosis. However, finding of widened mediastinum or enlarged aortic knob may raise a suspicion of a thoracic aortic aneurysm. So per chest x-ray for example mediastinum widen shui like my previous pictures that's the x-ray mediastinum wide shi aga sign the aneurysm sign hum warkai. And CT angiography is basically used to establish a definitive diagnosis of the thoracic aortic aneurysm, and it usually involves the use of like intravenous contrast dye, which can allow sufficient visualization of the aorta. So in terms of management, so it's an essential part. An essential part of the management is to manage the underlying risk factors through measures like controlling blood pressure, controlling the cholesterol level, and also quitting smoking. And surgery is usually not an indication for aneurysms that are less than 5 centimeters. And they usually require close observations. However, in some cases, example, beta blockers or example, ARBs such as losartan is given in case example of Marfan syndrome in order to slow down the expansion of the aortic root. And also surgery is indicated for aortic abdominal aneurysms if they're greater than 5.5 centimeter in size, as they have high chance of rupture, and most likely endovascular stenting will be used. So this type of stenting is more likely to be used. And also emergent surgical intervention is usually indicated in the events that are thoracic aortic aneurysm dissects or ruptures. In those cases, the majority of patients with thoracic aortic aneurysm who are symptomatic, management usually consists of observation through imaging, typically via CT angiography, MR angiography as well. So usually most importantly for management that treatment ke by the risk factors control she like a blood pressure by control she cholesterol level control she kastugyo smoking quit she and surgery that usually ka aneurysm che the 15 centimeter na landi like a daga pictures ke. So example ka aneurysm yani da dilation che between 3 to 4.4 centimeter no data so basically ka aneurysm the 5 centimeters na landi no aga surgeries na require kay. So example ka aneurysm between 3 to 4.4 centimeters the agi management to the annual ultrasound da yani har kal bait aga ultrasound sara observe shi ultrasound sara check shi. Okay, example aneurysm 4.5 to 5.5 then ultrasound that every 3 months by ultrasound the patient by every 3 months ultrasound she. Okay, example over 5.5 centimeter in Aziati the aneurysm yani the dilation the diameter these areas kada the 5.5 centimeter in Aziati no the surgery involved or this surgery chida usually endovascular stenting da so that this endovascular stenting way. So for that first with your catheter then is like they first like insert this tube and then they insert a catheter and as they collect the catheter draw no dio stent form basically. So the stent for that the surgical treatment that this like they basically form a stent here. And so that's all from me. Thank you very much for listening. And though أميد لرم تاسو تنا سي مفهوم دينا غشتيكا any questions تاسو معنا بختنكا ولا شيء. And also زما أخبلا زما your test وامتحان so I was trying to work on the preparing a presentation and also revising for my own test. So I hope تاسو تنا سي مفهوم غشت شوي. So that's all from me.